Hello, thank you for your so kind invitation. It is a great pleasure to contribute to today's discussion, sharing experience from Scotland. And so I googled this morning the word efficiency. It surely is a hot topic, especially these days during a pandemic that is carrying on. To set the scenes, I will take you on a time capsule back in the 1993 in Greece, where me and my best friend were watching this movie, The Groundhog Day. My friend was diagnosed with a rare bone cancer and was about to start neoadjuvant chemotherapy. In fact, he would be admitted to hospital the following day. Seeing healthcare through the eyes of the carer from the receiving end was an eye-opener for me and followed me through my career in medicine. I understood very early on that what efficiency means to a patient, the carers, the family, may differ to what it means to a professional. It influenced my decision to become an oncologist. I am Ioanna Nixon. I am a sarcoma oncologist at the Beatson, one of the biggest standalone cancer centers in Europe, and an academic at Strathclyde University with a special research interest and focus in health policy, medical leadership, quality of life, and survivorship. Like in the movie, in healthcare, we frequently feel stuck, unable to change. We look at inefficiencies, waste, but yet we do improve and we innovate through adversity. We have gone far since 1993, with evolutions in cancer therapy globally. And looking into the future, what we want to create is a preventive, bespoke for all, efficient, humanized cancer care ecosystem through innovation, research, and policy improvement. And this through maximizing strengths, opportunities, aspirations to reach the results we want for better patient care and shared learning. We're now 2 years into the pandemic, and the climate in healthcare in the UK is rapidly changing. West of Scotland is no exception. There's a word for it, coined many years ago by the military, and that is VUCA. And in many respects, VUCA is the new normal. And in this climate, the urgency for change is the first driver to improve efficiencies and to innovate. The pandemic accelerated a changing approach to healthcare. Cancer services have rapidly responding to the changing requirements. Digital health is emerging with AI, wearable technologies, and telemedicine helping us reduce costs and drive efficiency whilst improving accessibility and convenience. At the same time, unhealthy lifestyles and aging population lead to increase in cancer incidence. 2 out of 5 people will develop cancer, and cancer is a national priority. Sustaining and keeping workforce well is another priority, while we also need to keep up with the fascinating advances in precision medicine. Climate change will also impact on services, and we have to consider the effects of the climate change to make services more resilient. In our era, with pressing needs for change and outstanding opportunities, I reached out to my diverse network of peers, juniors, patients and carers, academics, government, industry and charities, asking the question, what is efficiency in cancer care? What are the enablers? What are the barriers? And here is what they have said. Efficiency is about having the right conversations at the right time, in a way that creates and sustains real communication, and the Scottish Patient Safety Programme is an example of the above, focusing on access, quality and sustainability. Efficiency is also about a consistent approach to cancer care and reducing inequalities across the country. A way to support all above is clever use of technology, moving to a tech-enabled care. Efficiency is also hugely about listening to our patients and their families to understand what matters to them. It is about tackling health inequalities, about identifying cancer early. It is about offering patients holistic care. All above are so rich and full of perspective, suggesting efficiency is not nice to have, but imperative. We all know that. Through increasing capacity, capability, connection, and fostering a culture of innovation. We need to use current resources better. We need to reduce waste. We need investment and added value, knowledge, and people. Our only hope to meet patient needs in the VUCA world, which nicely brings my focus to the needs of people with cancer. According to this survey, patients identified as key priorities in terms of efficiency: early cancer detection with correct diagnosis made promptly. Get it right the first time. It is about offering information, support, and deciding together with the patient. It is about a holistic approach to their needs and also acknowledgement of the financial impact of cancer. I mentioned Get It Right the First Time, and this is a national program in the UK, Getting It Right First Time. It is designed to improve treatment and care of patients through in-depth review of services, through benchmarking, and presenting a data-driven, evidence-based to support change. Hearing more from the patients, Macmillan's support led to the development of a program, Living With and Beyond Cancer, and this to understand what people with cancer want from their care. Work through NCRI and James Lind Alliance addressed that what patients set as 10 key research priorities, a call to action for all of us. This is consistent with my personal experience as an oncologist and having been the chair for the NCRI Survivorship Head and Neck subgroup. Patients need treatments that lead to better outcomes, with less toxicity, better survival, better quality of life. They need care delivered in a service that supports them, that understands them, and acts to their needs with compassion. They need support with prehabilitation, rehabilitation, and recovery. And starting with cancer therapies, cancer treatment, this is a quote by Molière, which some of my surgical colleagues would use to tease us oncologists, and dare I disagree. We understand more in the era of precision and realistic medicine, and increased use of new therapies, such as immunotherapy, created the need for different models of service delivery, looking at efficiency differently, including prescribing, dispensing, and administration. And in this climate, efficiency is key. Expanding further on cancer priorities, here is a list for Scotland and I believe beyond. We have an increase of 11% over the last decade. However, with effective population-based screening programs, earlier detection, better diagnostic methods, and advances of treatments, more people in Scotland are surviving cancer than ever before. Mortality rates were 78% higher in the most deprived areas compared with the least deprived, so tackling health inequalities is a key priority to reduce health gaps. Starting with prevention and health promotion, what we do is we use innovation to increase efficiency, as innovation can help raise awareness, use data to create algorithms and identify those at higher risk of developing a cancer to intensify screening, prevent, or delay presentation of disease. Moving on to early detection, innovation can help with early diagnosis to improve outcomes. Genetic testing is a priority. Whole genome sequencing can detect diseases early, can also identify druggable mutations in tumors, offering the right treatment to the right patient. Whole genome sequencing can also show which patients are not likely to benefit from a specific treatment. This can save unnecessary treatments and toxic side effects. Genomics makes personalized medicine possible, with a real impact on patients and their health outcomes. And one day, every patient will have whole genome sequencing as standard of care, like we do routine bloods. At the same time, we need innovations in the delivery of care, complex, innovative design of clinical trials to increase efficiency. This is all happening in our complex innovation ecosystem with all these partners, as you can see on the slide. Key stakeholders represented, but at the center, the population, the people, our living lab, all playing a specific important role on cultivating, supporting, and delivering innovation. Something important to mention is Scotland's infrastructure, which is designed to increase efficiency. And to this direction, we have established national clinical managed networks. These networks are bringing stakeholders together to improve safe and effective delivery of care that is designed around patient needs. And they're linked group of health professionals and organizations from primary secondary and tertiary care, working in a coordinated manner, unconstrained by existing professional and health board boundaries to ensure equitable provision of high-quality, effective services. Here you see some projects from my own practice in keeping with all above-mentioned priorities, showing the diversity and broadness of approaches to efficiency through quality improvement, innovation, and research, and also showing the diverse network of people involved to make it flourish. Starting with the early cancer detection centres, which are being piloted, and I am involved in the evaluation of these, working with a group of academics, clinicians, and the Scottish Government. Moving on to research, the Sarcoma Accelerator Consortium is a 5-year CR UK funded ambitious project aiming to produce a digital hub of clinical and research data on sarcomas, as well as cellular and animal models. This digital hub will help us predict and test patient responses to drugs for high-risk sarcomas using AI. We also looked at the impact of telemedicine for sarcomas for patients and specialists in Scotland, and the National Sarcoma MDT, multidisciplinary team, which was a project to transform the sarcoma MDT, starting with process and also culture. And it led us being finalists for the BMJ Awards. We also evaluated non-medical prescribing in an outpatient clinic, and this project led to a nomination for HSG Partnership Awards 2022. So these are some examples on early cancer detection, novel research, and use of skill mixing to increase efficiency. And no doubt there are many, many more examples. This is Janus, the Roman god. He's very unique in that he has 2 heads, one with eyes facing forward and one with eyes facing backwards. He's the god of transitions, and January is named after Janus. What we can keep from Janus in healthcare and in oncology around efficiency is that we need to look backwards at the processes and structures that we have and how we can make this more efficient, effective, cost-effective, and safe, while simultaneously facing forward, thinking of the innovations that we need to essentially disrupt current processes to take us where we need to go. We need quality to be the base in healthcare in everything we do. Nicely said, but how? It starts with urgency, bringing people together using skill mixing and shared leadership approach. The strength lies in the network, the people, setting priorities, working together, top, bottom up. We are innovating, and we can do better to build a preventive, bespoke for all, efficient, humanized cancer care ecosystem. This through maximizing strengths, opportunities, aspirations to reach the results we want for better patient care. Through distributed leadership, fostering collaboration and close partnership on equal footing with all stakeholders to get it right. And I will leave you with the words of a cancer patient.
Hi there, my name is Josh Cairns and I'm on my 72nd year in age, and I worked until I was 68 years of age, but 2 years later I was diagnosed with facial cancer, a rare type of cancer called angiosarcoma.